Okay, good morning, good afternoon, good evening po sa lahat. Saan man pong panig kayo ng mundo naroon. Welcome to our 185th episode of the Health Updates webinar series. Thank you for being part of our credible online community. And to all those who have just discovered us for today, welcome po. Malapit na po matapos ang March po, which is our celebration of Women's Month. And I hope tuloy-tuloy naman po ang inyong pagtangkilik, panonood at pagsuporta po sa atin. For today, pag-uusapan po natin wound care and burn injuries. Ang burn injuries po, they present multifaceted challenge. Meron po mga immediate tissue damage, meron din po mga complex wound care. There may be a need for rehab later on. So for today's webinar, pag-uusapan po natin yung burn injuries, treatment modalities, ano po ba yung mga prevailing myths and superstitious beliefs po that hopefully our experts will be able to discuss and debunk in this episode for today. We'll also explore ano po yung mekanismo po ng burn injuries, cascading po yung mga inflammatory responses, tissue repair, scar formation, what are the advancements in wound care, including ano po yung mga makabagong dressings, regenerative therapies, personalized treatment approaches, baka mapag-usapan po natin, and how can we optimize patient outcomes and minimize long-term sequelae po. So without further ado, I'm Dr. Raymond Francis Sarmiento, Director of National Telehealth Center, National Institutes of Health, University of the Philippines, Manila. Always a pleasure to be with all of you during our Friday. For today, just for today po, no, we are very lucky, and it's also my pleasure and honor to host this program with one of the stalwarts, pundasyon po ng ating programa, Dr. Stella Mariose. Dr. Stella?
Good afternoon, Doc Raymond, and to all our audience. Welcome to the live broadcast of the Zoom webinar and all those watching in TVUP YouTube channel and also in the UP System Facebook page, TVUP Facebook page, and of course, all those watching in TVUP Signal TV channel 101. Our panelists for today are Dr. Rowena Sudario Lumage and also Dr. Francis and Carlos. Okay, so you have seen our opening billboard and our program is now called Health Update. So hindi na ho kami Stop COVID Deaths kasi ho wala ng COVID. So our program, we have now done a little reformatting, and also our program, but we still maintain the same high quality and leveling up to take a closer look at the existing and emerging health problems in the Philippines and in the world. So for 2024, we want to get immediately into the heart of discussion. So our program will now be shorter, 1 hour na lang po. But before we go to the presentation, Raymond will introduce our person on the street video.
Thank you.
Just to give you an insight, that's why we chose the person on the street, because we want to know what the people outside think of all these problems that we're having, these illnesses. So gusto namin malaman yung pulse of the people. Okay, Raymond?
Thank you. Thank you, Ma'am Stella. For today din po, no, just to remind everyone, yung Marso po is also Fire Prevention Month, and it's also one of the things that we had in mind, kaya po ito po yung topic na napili po natin na pag-uusapan for today. And for today, and also continuing lang po dahil we have well, it's still March and it's still Women's Month po, no, we have two very excellent po na female speakers for today. But for the PATS, ang mga katanungan po natin sa ating mga interviewees, they are as follows. Number 1, kung nakaranas na po kayong magkasugat o sunog sa balat, o may inalagaan na kayong nakaranas noon, paano po siya nagamot? Ano po ang narinig ninyo ng mga paniniwala o mga pamahiin tungkol sa paggamot ng mga sugat o mga paso? May mga bawal bang gawin o bawal kainin kapag magpapagaling ng sugat o sunog sa balat? Alam nyo ba kung ano-ano ang dapat gawin kapag nagkaroon ng sugat o sunog sa balat, at alam nyo rin ba kung kailan kailangang dalhin na sa ospital ang mga taong nagkasunog sa balat? Please watch this.
Nung bata ko, madalas ako nagkakaroon ng sugat sa tuhod dahil nadadapa kakalaro. So, mostly ang ginagawa namin doon as first aid ay naglalagay kami ng betadine and alcohol.
Well, we treated it first with antiseptic, And then we had dressing after.
If major na sugat siya, dadalhin agad namin sa ospital kasi hindi, honestly, wala namang nurse or like med student sa family namin. So, hinahayaan namin na professionals handle those kinds of things.
Ang isa sa mga pamahiin, ang mga panakot sa bata pag nagkakasugat ay may mga lalabas sa pare, ganyan. Pero yung mga sinasabi na mga bawal kainin ay yung mga malalansa dahil mas matagal daw itong mag-heal.
Yung mga pamahiin na I've heard before was that dapat the wound could breathe, dapat nakakahinga daw yung sugat, hindi daw siya dapat tatakpan, tapos bawal daw kumain ng mga malalansa like fish.
I think the first wise thing to do is to wash the wound and then mag-apply ng antiseptic or like betadine, ganun.
I think it depends on what type of wound it is. So you can depend on what type of degree burn it is. But there's ointments you can put on, antibiotics you can take.
Personally kasi, nagkaroon ako ng sugat nga dati sa tuhod noon bata ako. Pero ngayon, kapag nagkakasugat ako, ang ginagawa ko talaga ay naglalagay ako ng betadine. Tapos, minimake sure ko na malinis yung paligid ng mismong sugat. Kapag napapasok naman ako, ang una kong ginagawa ay cold compress or i-run lang siya sa tap water.
Alam ko kasi bawal siyang i-wrap agad pag fresh kasi parang as far as I know, kailangan po na siyang patuyuin na sugat. Pero yun, patuyuin muna, tapos hayaan lang maglabas yung nana, ganon.
I think as much as ganun kalala yung sugat or yung paso, I think kailangan na siyang agad dalhin sa doktor. Yung tipong kapag hindi na siya nadadaan sa mga first aid kits.
I feel like kapag super numb na ng body part na yun, pag may dugo na rin na involved, yeah. Pagkita na yung flesh, pagkita na yung buto.
Second degree burns to third upper degree burns, I think. The moment na hindi na siya kaya i-dress ng maayos at home or walang equipment sa bahay to dress ng properly.
Siguro yun, bawal, lalo na kapag open wound, wag din sana siyang ma-expose sa maraming germs or like bacteria na maaari pang magpalala dun sa infection.
So for people with wounds and burns, I think the best thing you could do is know what type of it is first. Like accurately determine what type of wound or what degree burn it is before even trying to treat it. So the knowledge of this will give you the proper way to treat them. Kasi depende sa severity, iba-iba rin yung type ng pag-treat.
Okay, thank you so much, TVUP. And really, alam naman po pala ng mga tao yung normally na gagawin, no, ma'am? Very interesting lang po that I would have wanted. Maybe, alam po it's part din po nung increasing po the awareness and the knowledge din po kung kailan po dadalhin sa ospital at ano po yung gagawin kapag nasa ospital na po. What did you think of it, Ma'am Stella?
Oo, thank you, TVUP, for letting us know what the person on the street what they are thinking, no? And mabuti na lang ang gagaling ng ating mga speakers kasi ma-explain nilang maigi kung ano ang talagang dapat gawin. Okay, so ayoko na mag-make ng comment dun sa person on the street. So let's just
Aba.
listen to the presenters.
Sige, ma'am. So before before you introduce po our main speaker, Ma'am Stella, just a little bit of housekeeping for us. Those who are asking kung bakit hindi pa po sila naka-receive ng certificate, you can email us directly. We will recheck our records, but as far as we are concerned po, lahat po ng 108 certificates for 184 webinars po natin na i-send out na po namin. I think there are those that are still requesting lang po, no? Baka nagkamali lang ng spelling, etc. So those are the ones that we are also attending to. Kumbaga. But certificates of attendance po will be given to those who watch at least 50% of the webinar duration. And for our webinar today, just like in our previous webinars, we will be having a standard panel discussion format, and after our speakers have presented, that will be followed by a Q&A session po. So without further ado, here is Dr. Stella Jose to introduce our main presenter.
Okay, so let us now proceed with the topic at hand. And for our first speaker, we are lucky to have Dr. Rowena Sudario Lumage, who is an attending consultant at the Division of Plastic Surgery, Department of Surgery at the UTPGH. So makikita nyo ho, no, dumadami na ang women surgeons. Okay, so and that's very good. Okay, so now, Rowena, you can have your presentation.
Thank you, Doc Stella and Doc Raymond. I hope you can hear me well.
Yes, loud and clear po. Please
Yes,
feel
loud and
free
clear.
to share your screen, ma'am.
Let me just, so again, good afternoon, everyone. I'm Dr. Rowena Sudario Lumage, and I'm a plastic reconstructive and aesthetic surgeon from the University of the Philippines, Philippine General Hospital. And today I am tasked to talk about the prevention and first aid of wounds and burn injuries. So as a plastic surgeon, we manage all admitted burn patients in the PGH as well as complicated wounds of different etiologies. So I hope in this short presentation, I will be able to discuss the treatment of smaller burns and wounds that our current viewers may have encountered already and their appropriate management. For burn injuries, here are my objectives. So again, to discuss the most common types of burn injuries, to identify the different conditions that need burn center admission, and lastly, to discuss first aid management of the simple burns. For wounds, I will discuss the different types of wounds and their etiology. I will also discuss their management, as well as to discuss some myths about wound care. So let's begin. So in the Philippines, March is Fire Prevention Month because during these months, there are alarming increase of fire incidents happening across the country and during this particular period. And just 1 week ago, maybe you've heard in the news, the PGH had a fire that broke out in one of our areas. And fortunately, the fire was immediately put out. All patients and employees were safe and no injuries were reported. So by definition, a burn injury is any injury to the skin or other tissues caused by heat, radiation, electricity, friction, or contact with chemicals. According to the World Health Organization, burns are a global public health concern because it is potentially fatal and because it may lead to a lot of morbidities, including prolonged hospitalization, disfigurement and disability, as well as social stigma and rejection. The photo in the bottom of the screen shows a burn wound contracture, which results from the improper management of a burn injury. It is important to emphasize that all burns are preventable. So public health strategies are geared towards public information campaigns based on the mechanisms of the most common types of burns. So here, we've identified 6 types of burns. The most common in children are your scalp burns, usually due to spillage of hot liquids. Flame burns, the second type, are usually due to house fires and also associated with inhalational injuries, especially if a person is trapped inside and inhales a massive amount of smoke. Flash burns are caused by exposure to intense heat for a very brief period of time, and the most common examples of this are your LPG explosions. The next 3 types of burns are as follows. Your chemical burns is where strong alkali or acid gets in contact with the skin, and we usually see this in assault cases or industrial accidents. Another type of burn injury that is common in our country, it's also unique in our country, are electrical burns caused by electrical current passing through the body. And lastly, contact burn from direct contact with hot metal, glass, plastic, or hot coals. So again, all these burns are preventable, and depending on the severity and type, some warrant admission to the hospital immediately. If a burn is massive or severe, an immediate systemic and local stress response is triggered in the body. Unlike other disease entity, like sepsis or trauma, this does not recover quickly. So, severe burn cases causes a complex pattern of responses that can last up to several years after the initial insult. So this figure shows the multiple organs and their responses to a burn, which, if not addressed, can lead to organ dysfunction, sepsis, and death. That's why it is important to mention the following criteria for a burn center admission. So we all know that a major burn injury is resource intensive and needs a specialized center with a multidisciplinary team of medical and paramedical personnel. Burn injuries not only has an impact on the patient, but also on the life of the caregivers and families, often for a long period of time. That's why this is recommended for massive burns. So those involved in burn care, especially in specialized areas, must adapt their goals not only for immediate survival, but to include goals that address scarring, long-term well-being, mental health, and quality of life. So the criteria for burn center admission are as follows. So all moderate and major injuries, meaning for adults, those with more than 20% total body surface area burned, and for children, more than 10% total body surface area burned, should immediately should always bring them to a burn center. All patients less than 2 years of age, regardless of total area burn, should also be admitted. All patients with injuries to the critical areas like hands, face, feet, and perineum should also be admitted. Those with third-degree burns in any age group should also be admitted, as well as electrical burn patients and chemical burn patients. Those patients with a suspicion of smoke inhalational injury and other associated medical illness or with multiple trauma are also advised to be admitted. And finally, all patients with massive exfoliative diseases as follows should be admitted to the burn center. Once we assess that a burn is not admissible to a hospital, the following first aid measures can be done. So first, we need to stop the burning process. So what's the most appropriate thing to do? So the first step is to remove the clothing and to cool the burn under running tap water or saline. So I'll emphasize not ice for 20 minutes. It is also important to give pain relievers like acetaminophen or NSAIDs for these patients to alleviate the pain, and consider also its use during physical activity and every dressing change. Cleansing the wound with an antiseptic like, as mentioned earlier, betadine solution is also important. Small blisters can be left intact, but large blisters that are likely to rupture should be removed. So how often do we need to change the dressing? So frequency of wound dressing depends on the availability of materials, but more advanced dressings has the advantage of less frequent dressing changes and should be used if available based on the latest guidelines. It is also important to update the tetanus vaccination of patients with burns. According to the latest guidelines by the Philippine Society of Microbiology and Infectious Diseases, if status of the tetanus vaccination of a patient is unknown, tetanus toxoid and tetanus immunoglobulins should be administered. Finally, the question is whether we should give prophylactic antibiotics for minor burns. So again, we are still talking about minor burns in this case. The recommendation is that we should avoid the use of prophylactic systemic antibiotics for acute burns. However, we should be made aware of the warning signs of infection, such as fever, erythema, body malaise, foul odor, increase in pain, and anorexia, and seek medical advice if this is seen. So, children are one of the identified groups vulnerable to burn injuries, as well as those living in low and middle income groups. So due to overcrowding in their houses and lack of proper safety measures. So a big part of prevention measures is to ensure that the home is fire and scald proof, as shown in these public safety reminders. So I will now proceed with the second part of my lecture, which will be about wounds in general. So as mentioned by our hosts earlier, March is also National Women's Month. I was thinking of a type of wound that is unique for women. And I have come across this powerful photo of Allyson Felix. She is an American and the most decorated female track and field athlete in Olympic history, shown here with her medals and her CS scar. She is also an advocate of maternal health as well as pay equity among athletes. So as I mentioned earlier, as plastic surgeons, we deal with a lot of wounds like these CS scars as I've shown earlier in our practice. One procedure we do if the scar becomes unsightly is a scar revision. But as much as possible to avoid this additional operation, we want acute wounds to have the ideal environment for healing and for it to result in a relatively nice looking scar. Because especially in visible areas like the face, these unsightly scars can cause low self-esteem and distress in some patients. So what is a wound? A wound is any injury or trauma to the skin with or without injury to the underlying tissues. There are two types of wounds, simple and complex wounds. I will talk about these two types in the following slides. So the first type are your simple wounds. Simple wounds can be closed by primary closure or secondary intention and are expected to heal timely without complications. Examples of these simple wounds are as follows. So first are cuts or lacerations, also known in Tagalog as hiwa. Scratches, your abrasions or gasgas. So burns, we've already talked about this, paso, lapnos in Tagalog. Insect or animal bites, kagat ng hayop, and also post-surgical wounds or mga tahe. Complex wounds, on the other hand, are wounds that need other techniques and several other interventions for closure and warrant referral to a wound care specialist. So we also get a lot of these referrals for which we do additional intervention or operations. So examples of these complex wounds are as follows. So infected wounds or those with cellulitis, ingrown toenails, cancer wounds, diabetic wounds, vascular wounds, pressure wounds or bed sores, severe burns, and major limb trauma or fractures. So these complex wounds are also fairly common, especially in the vulnerable groups, the elderly, and those with other comorbid conditions. And they need very specialized care and also a multidisciplinary approach in their management. So this part of my lecture, I will now be discussing the management of simple wounds. But first, before doing anything, so when you get a wound, you first, and you want to dress or care for it, you need to wash your hands. So here is a simplified wound care steps for simple wounds. So first, rinse, cleanse, and cover. So these are your 3 steps. So rinse, you rinse the wound with water, normal saline solution, and you want to remove the previous dressing. You cleanse the wound with an antiseptic solution. And the third step is to cover and apply appropriate dressing to cover the wound. In the following slides, I will discuss this one by one. So again, in rinsing the wound, we need to remove all debris as well as the previous dressing, if any. So depending on the mechanism of the wound, We are not sure if this is a dirty or a clean wound. So we do wound irrigation until the wound is visibly clean. And if there is bleeding, we need to apply direct pressure continuously until the bleeding stops. We can use clean potable water or saline solution plus mild soap for rinsing. So for the next step, cleansing the wound, it kills the pathogens resulting in a sterile wound. So we need to emphasize gentle application. So gentle meaning you just dab, not scrub, an antiseptic solution. And this antiseptic solution includes povidone iodine. So this is your betadine, chlorhexidine, PHMB, and hypochlorous solutions. So these are all available commercially and in your big drugstores. So I want to emphasize alcohol and hydrogen peroxide should be avoided unless the wound is very infected or severely bleeding. Finally, covering the wound protects it from desiccation and infection. So the use of traditional dressings or simple dressings like band-aids, antibiotic ointments, film dressings, and gauze is acceptable, and these are usually changed or applied daily. While the second type of wound dressing, the more advanced and the latest, are your hydrocolloid dressings, hydrofiber with silver dressings, tool dressings, and foam dressings. So these dressings has the advantage of being changed every 3 to 5 days, so there'll be less frequent change of the dressing. So we now come to the last part of my presentation where I will discuss some common misconceptions in wound care. So fact or myth. So the first one is do not wash or wet a wound. So this is a myth. So this is false. So as mentioned earlier, it is important to rinse a wound with clean water, whether a simple wound or burn. And then you use clean tweezers to remove visible debris and use mild soap, baby soap as initial cleanser. The next statement is applying hydrogen peroxide to wounds for healing. So will it make healing faster? So again, this is a myth. So this is false. Unless the wound is infected or there is bleeding, hydrogen peroxide is potentially cytotoxic to healthy cells and should be used cautiously. The next statement, so keeping the wound exposed to dry it faster. So again, this is false. So wounds actually prefer a moist rather than a dry environment for healing. So a scab of a dry wound acts as a barrier of wound healing since there will be less blood flow and nutrients that will reach the wound bed. On the other hand, a moist wound will result in faster healing because a moist environment is more ideal for wound regeneration. It also results in less pain and less scarring for the patient. And finally, with regards to the diet, we often hear this, so avoid eating chicken, eggs, or seafood because it delays healing. So again, this is false. So I want to emphasize that nutrition plays an important part in wound healing, and a protein-rich diet, which is actually found in your chicken meat, eggs, and seafood, is actually needed for good wound healing. Other known nutrients that aid in wound healing are vitamin C, iron, and zinc. What we advise patients is only to avoid eating food that you are allergic to. And also, I would like to mention that diabetes is presence of diabetes impairs wound healing, so strict sugar control in patients should be emphasized. Diabetes decreases your immune response resulting in increased infection risk. So this is my last slide. In summary, burn injuries are preventable and should be managed promptly and properly. Awareness of conditions for burn center admission should be emphasized to avoid complications. Wound management is based on a multitude of factors that can affect healing, and proper wound care principles should be followed. So thank you again for your attention and have a restful and blessed week ahead. So thank you, everyone.
All right. Thank you so much. Dr. Oweng, thank you so much ha. Marami po ako natutunan. Unang-una na doon yung yung malansa pala ay hindi bawal, Ma'am Stella. Yung po pala ay isang myth na laging lagi pong sinasabi sa amin mula nung pagkabata. What did you think of it, Ma'am Stella?
Oo, ang galing ng lecture ni Weng. So, maraming matututunan talaga, no? So, eto naman, pwede niyong panoorin at a later time to our audience. So, meron naman tong replay. And so, it's really, iba talaga yung level ng intellectual discussion ni Weng. So, sundin natin yung mga ina-advise nila, no? Yung wag natin, kasi marami nag-wido. Oh, parang ganito ang gagawin. Ganyan. So, yung kagaya yung hindi tatakpan. Nako. Siyempre, pupuntahan niya ng mikrobyo, no? Anyway, thank you very much, Weng, for your lecture.
Thank you, Dr. Oweng and Ma'am Stella. Before we introduce po our reactor for today, we wanted to make sure that all of you are putting in po your questions. We see a couple of questions has been added po since the lecture has started. So we still encourage everyone to put in your questions here in the Q&A box of Zoom, but also dun po sa mga Facebook pages po natin. Baka you can also put them in the comment section po, no? We'd like to also greet those who are joining us. So hindi po natatanong, we are napapanood po tayo locally. So maraming salamat po sa mga nanonood po sa atin. Very important po kasi lagi pong how do you say? Lagi pong naitatanong sa amin kung sino-sino pa ba yung nanonood, whether locally or internationally. So locally po, from the Philippine Science High School in Cagayan Valley Campus in Bayumbong, Vizcaya, UP Mindanao in Davao City, Valladolid District Hospital in Bacolod City, Negros Occidental, from the Chonghua Hospital in Talisay, Cebu, Lucena MMG General Hospital in Lucena, Quezon, and Mabuhay St. Francis of Assisi in Mondragon, Northern Samar. Internationally, nanonood din po ang mga taga Chonin Hospital in Taipei City, Taiwan, the University of the Philippines Nursing Alumni Association International in New Jersey, in the United States, King Khaled Eye Specialist Hospital in Riyadh, Saudi Arabia, and I believe there's one here from Algeria po. So marami po talaga, and we're very thankful, and hopefully you're able to apply the lessons that you learn from this webinar po, no? And for our reactor for today, she is a medical specialist from the Philippine General Hospital's Department of Rehabilitation Medicine. Please welcome Dr. Frances Ann Carlos.
So good afternoon, everyone. Thank you to the TVUP team for inviting RehabMed in this webinar as a reactor. And thank you to Dr. Weng Lumage for the very informative lecture. So in the interest of time, we'll focus on burn rehabilitation, especially since this is also the fire prevention month. So burn rehabilitation can be divided into 3 phases. So in Filipino po, ang pag-aalaga sa sugat ay hindi lang po tumitigil pag naghilom na po ito, no? So pag medyo malalim po ang sugat, lalo na kung medyo malalang burn wound po ito, pwede itong magdulot ng peklat. So this can be divided into 3 phases: the acute phase, the wound healing phase, and the rehabilitation phase. And throughout this spectrum, we're working closely with the plastic surgery team. So we'll go briefly and discuss each phase and the goals for each of these conditions. So as mentioned by Dr. Lumagi earlier, prevention is better than cure. And as a reminder, during the March Fire Prevention Month, all burns are preventable, so this should always be the priority. However, if a burn injury occurs, the first phase, which is during the first 3 days of injury, Our goal for this phase is focused on facilitating healing of the burn wounds, positioning the limbs properly, and controlling the edema. As you can see in the picture, this is the ideal position for a burn patient to prevent contracture. So the neck should be hyperextended, the shoulder is abducted, and externally rotated. Both hips should be maintained in neutral with the knees straight and the ankles in dorsiflexion. The affected limbs should also be kept elevated to prevent edema, and we can prescribe splints to keep the affected areas immobilized in the ideal position. So one of the critical areas in burn injuries is the hand, and it should be kept in a safe or functional position through splinting. This safe position of the hand keeps the critical ligaments of the finger joints in extension to prevent shortening and contractions. During the second phase, or the wound healing phase, most of the wounds and grafts have already healed. So this is our goal for this phase is to prevent contracture, regain the range of motion, prevent deconditioning through early mobilization. So the video on the left shows one of our patients exercising while still admitted at the burn unit. So as long as the patient is stable and there are no contraindications such as immediately after wound grafting, exercises and ambulation training can already be initiated in the patient. So our main goal again is to prevent deconditioning and make the patient as mobile as early as possible. Splinting is also continued for the patients to maintain the range of motion of the affected areas. Finally, for the rehabilitation phase, which is the longest and may even take years in some cases, the focus is shifted to scar management as they begin to reach maturity. So the main goal is to control the hypertrophic scar growth, prevent contracture, enhance function, and facilitate community reintegration. So ang end goal po throughout all these phases is to help our patient go back to their community and function as normally as possible. Immediately following wound healing, a scar is usually blanching and red when pressure is applied or when stretched. So as you can see in the picture, the knuckles of the patient turns white when being stretched and when pressure is applied. Between 3 months and 2 years, the scar should become paler, flatter, softer, and can then be referred to as a mature scar. So aggressive scar management should be initiated as early as possible while the scar is still immature. So this is again characterized by redness, blanching when pressure and stretching is applied. Our end goal for this is to prevent hypertrophic scarring. So at this point, splinting is continued for most patients, and it can be through serial splinting. As you can see in the image on the left, I had a patient with excessive burn scars. So there's beginning contracture on her neck, and we started serial splinting. So serial splinting means that the splint provided for the patient is being remolded every now and then to accommodate and provide the necessary stretch. So this is a challenge, especially for our pediatric patients, no? Since they are still young and growing, they have more propensity for contracture formation. Another management for scar is pressure therapy. So the hypertrophic scar we mentioned earlier, when they're still immature, they blanch and are usually turns white after application of stretch. So using that principle, we apply pressure therapy and scar massage to prevent or hinder the progression of hypertrophic scar. It's only in PGH where we have a sub-acute per unit nationally. So this is only just 2 beds for the whole Philippines. Konti pa lang po yung burn units natin throughout the country, and sub-acute burn unit is just only 1, which is dedicated for burn rehabilitation. So in this picture, we can see some of the interventions we apply to our patients. Again, we provide adequate splinting to keep the limbs immobilized and prevent progression of contractures. You can also see the picture on the right, wherein our patient's grip strength is measured. Since, as mentioned earlier, we want them to return as normal to function as possible. We also provide adaptive tools. So we have modified utensils. So for example, the patient is unable to hold a spoon or a fork. We modify them so they can still perform the activities independently. In the occupational therapy section, we also make them simulate activities of daily living, such as feeding, grooming, bathing, and other vocational training. As mentioned by Dr. Lumagi earlier, burn wounds, especially if excessive or if it involves the face and large areas of the body, they actually provide or cause distress or psychological stress to our patients. So our treatment and rehab is not limited to medical or clinical. We also provide psychosocial support to our patients. So in the rehab team, we have psychologists. And in addition to that, our lead rehab consultant for burn, Dr. Dorothy D. Chingbing Agsaway, formed a burn support group. So the patients previously admitted from the burn unit and eventually was transferred to our subacute burn unit in rehab. They get together every now and then, usually annually, in partnership with the Physicians for Peace Philippines, and they hold activities. So previously, they visited the Manila Ocean Park. Recently, they had the Christmas party, so it helps them find a sense of community and relieve the stressors associated with having a burn injury. As mentioned earlier, our end goal for our patients with burn is to help them achieve community integration. So this is one inspirational story. We had an electrical burn patient, a high voltage electrical burn patient, and due to excessive injuries, his hands were almost amputated. So our very competent plastic surgery team, they opted to do a limb salvage procedure instead of amputating both hands, which would greatly impair the patient's function. So after the successful limb salvage through flap, the patient was transferred to our subacute burn rehabilitation unit. So we provided the therapies mentioned earlier, providing splints, aggressive mobilization, stretching, and positioning. And once all of this were done, we were able to send home the patient with actually very functional or highly usable hands, no? So even if the patient had severe contractures, he was still able to write, he was still able to perform activities of daily living without assistance, and return to his community without difficulty and able to perform activities independently. So just to summarize, again, ang sugat po, hindi nagtatapos ang pag-aalaga natin nito sa paghilom. Karamihan po dito nagiging peklat. So during the acute phase, wound healing phase, and rehabilitation phase, our rehab team provides services to help prevent contractures, help prevent psychological stress, help prevent deconditioning. And at the end of the day, our end goal is for our patients to reintegrate back to community and hopefully return to work, return to their family, and enjoy going back to what they usually do before the injuries. So thank you for your generous attention, and we'd like to invite you to the 10th Burn Care and Rehabilitation Conference, Bridging the Gap from Facilities to Communities. It will be held on June 7 to 8 at the Quirino Memorial Medical Center. So thank you again for the invitation and hope to see you in our Burn Care Conference.
Oh, thank you very much, Dr. Frances Carlos. Very, very well documented lecture, no? And we're very impressed with the muntik na ma-amputate yung kamay. Paano hindi na-amputate? My goodness. Really, no, I have very high regard for rehab medicine. And kilala ko yan si Dr. Dorothy Chingbing. I met her already, and she's also very talented. And thank you to Rowena also. Magaling pareho. Ano masasabi mo, Raymond?
We're
Wala
very
ka-
lucky. We're very lucky, Ma'am
Yes.
Stella. Opo.
Oo, ang galing. Bilib ako.
Baka we can ma'am, we can start off with the first question if you had the first question in mind, Ma'am Stella.
There was a question in the chat box from
Mm.
Dr. Joseph Tortona. Yung kanyang first question, what is the best therapy to prevent contractures from burns affecting joints? Any of you who wants
Mm.
to answer that one?
Good afternoon again, everyone. So I think Dr. Francis has answered that question already. So I think the best management still is prevention. So appropriate management, early intervention for burn wounds will prevent your contracture.
Yes. Okay, ang daming questions kasi ni Dr. Joseph.
Okay po yun.
So, what are considered as prophylactic therapy for burns?
Maybe Dr. Joseph is talking about the antibiotics, prophylactic
Mm.
antibiotics. So I already to emphasize again. So simple wounds don't need systemic antibiotics. They're considered clean. So unless there are obvious signs of infection, so there's no need to use antibiotics. Yun po.
Okay, I hope Dr. Joseph that was clear for you, no? So, kasi nga pag nagbigay tayo ng antibiotics na wala namang microorganism, it's futile. So,
Mm. Mm.
kakaroon lang tayo ng what do you call that? Yung uh, hindi walang buti siya, no? Walang benefit. Okay. So, any questions for Dr. Carlos? Baka merong gustong Raymond, do you have
Mm.
questions for
Actually,
Francis?
ang question po that I got was that, but I'm not sure if it was not clear po, no? Meron daw po siyang mga paso dati na feeling niya kaya niyang kayanin sa bahay at hindi na po siya kakailangan sa ospital. And then eventually, lumala siya and then kailangan niyang ospital. Parang at which point, how would you know daw po na eto ay kailangan nang dalhin sa sa hospital versus yung kasi yung Pilipino mas gusto nila yung parang kakayanin nila hangga't kayang kayanin. So ano po yung what will be the signs, Dr. Weng, for that one po? Na clear signs that they should go to the hospital.
So very good question yan, Doc Raymond.
Mm.
So actually, I did not discuss about the uh, degrees of burn injury. So if maybe we have an idea, first, second, third degree burns. So first degree burns usually would heal in less than 7 to 10 days. So this can be managed at home using yung what I mentioned as wound approaches to simple burn wounds. But of course, if there are signs of infection, namumula, sobrang sakit, may amoy, mabahong amoy, yun yung mga signs na kailangan na siguro dalhin sa hospital or kumonsulta sa doctor. And especially for wounds that don't heal in maybe 2 weeks time. So these wounds have the tendency to be have prolonged healing and excessive scarring. So ito na yung kailangan talagang dalhin na natin because prone siya to the complications mentioned earlier also.
Okay, that's good. Question, follow-up lang po, Dr. Weng. Ako po ay may diabetes. So parang natatakot daw siya mapaso or masunog daw po. Baka daw hindi gumaling or something. So what will be your advice, ma'am, for that po?
Okay, so it's very common we see diabetic patients because also of neuropathy. Hindi na nila nararamdaman yung sa balat. So sometimes konting hindi nila nararamdaman, sobrang init na pala ng tubig. So we really see these patients. So actually gumagaling naman sila but maybe takes a longer time and very important the management of their sugar, so glycemic control at the same time. So kailangan lang talaga matutukan especially ng specialista sa burn wound. So may pag-asa naman, Doc Raymond, di naman. Di naman.
I was going to say nga na I think the best is blood sugar control. Whoever asked that question, walang magic. It's really about blood sugar control. Bawasan mo yung kain ng matatamis, yung mga soft drinks. Yan sinasabi ko yan sa mga patient ko. So no, I'm not there I'm not making pintas other people, pero yun talaga ang management niyan. Yun talaga.
Okay. Okay. And question naman for I think this is more for rehab po, no? Is it really necessary yung I think she is referring to a splint, no, Dr. Frances. Kailangan daw po ba magsuot ng splint lalo na kung pagkatapos siyang siguro masunog daw po, and then is it yung pong maybe the positioning of it, is it really encouraged many months after the burn injury has occurred?
So yung pagsusuot po natin ng splint, it starts from the acute phase to the rehab phase. No? So nabanggit po natin ito kanina. Ang goal lang po talaga natin dito, wag pong sumikip yung balat. Kasi di ba po na-mention po ni Dr. Weng kanina, burn scars are prone to contracture. So ang tendency po talaga sisikip siya. So during the early phases, we want the patient to wear the splint even at least 23 hours remove it just for cleaning or just by when taking a bath, yun lang po talaga yung tatanggalin kasi we want the limb to be in a stretched position. Kasi kung hindi po, kung tatanggalin yung splint, ibabalik po namin kila Dr. Weng, surgical release na po ulit yun. So kaya po sumikip pa, wag po nating hayaang sumikip and isuot po yung splint as much as possible.
Ayun.
Siguro, Frances, kaya masakit siguro din yung splint, kaya may mga patients
Opo.
na
Yes.
nila.
Ano naman po, kaya po pwede natin gawin yung nire-remold, katulad po dun sa isang pasyente po na sumisikip yung leeg. So unti-unti po, kahit parang every week, itataas po natin siya unti-unti para hindi po nasasaktan yung pasyente sa stretch. Yun yung option po natin kung masakit.
Okay.
Thank you for your answer. So I hope that clears it up to the one who asked the question.
Yes, ma'am. This one, very interesting. I'll throw it to Dr. Weng. It's more about wound care and the scars that form. Yung po bang mga peklat, yun po ba, meron po ba talagang yung mga sebo de macho, kung mga scar creams, are those really effective daw po ba for scars, ma'am?
Siyempre, marami kasing anecdotal na kwento mula galing sa parents, ganyan natin sometimes. But if we look at the evidence, the only real evidence na can uh, uh, promote better scarring is your number one, silicone gel. Silicone, either in the form of gel and massage therapy. So if we go by evidence, that's the only two that is known to affect better scarring for wounds. So yung mga ointment or topical creams na yun maybe can afford some relief, but maybe not towards better scarring for patients. So yun na lang.
May I add din po, Doc, no? So, we have the immature and the mature scar. Baka kasi yung expectation ng patient, basta scar, kahit anong ipahid mo and apply pressure, gagaling po. So, during the immature phase, so kung meron po kayong sugat dyan, pwede nyong diinan. Pag pumuputi pa po siya, or yung parang nagbablanch, every time you apply pressure or stretch, that's an indication po na mag-work yung pressure therapy natin. Kasi kung hindi na po nag-iiba yung kulay or it's brown na, skin colored, it's non-blanching, it's not red, kahit anong diin nyo po dyan or scar massage na binanggit po ni Doktora, hindi na po magbabago yung peklat po natin. So important po immature pa yung scar when we want to intervene.
Yan ang sagot. Kailangan nagbablanch pa yung skin. Oo, ibig sabihin maganda pa yung blood supply niya, kaya gano'n.
Okay. Ma'am Stella, one question. This is one I think my childhood self would ask. Yung po bang mga mertiolate, alcohol at garlic? How can you expound on the old practices po? This is from Dr. Joseph Turton.
O sino na lang sa inyo ang may gusto sumagot naman.
Actually,
nabasa ko rin yan
up until now, we still get patients. Actually, nag-expand na nga yan, Doc Raymond, malunggay, ano ba, sa mga dahon, nilalagay, up until now. But, of course, if the setting is resource limited, we cannot blame these people, but if we go by, again, by evidence, so yung simple and or traditional dressings na I mentioned are better to be used if we can, or even better yung advanced dressings. So yun po.
Okay. Ma'am Stella, any questions on your end?
No question.
Okay. Okay po, if there are no questions, and I think a lot of our folks are also thanking naman po ang ating mga speakers. So maraming salamat po to Dr. Weng Sudario Lumagi from the Department of Surgery and Dr. Francis Arn Carlos from the Department of Rehab Medicine, both from the Philippine General Hospital. Maraming salamat po, and we hope you'll be able to join us in our future webinars po, no? And especially since we talk more about yan nga po, mga wound care, etc. Sometimes we'll just need maybe an update on those things po. So maraming salamat. As we are drawing to a close po, no, we will be launching po itong evaluation poll po natin. If you can see on the screen, this evaluation poll, yun, okay. So we have 5 questions. It's a 4-point Likert scale. It shows po 5 statements. I'll read them, and hopefully every one of our participants will be able to put in their feedback. So the panelists demonstrated thorough knowledge of the topic. Number 2, the panelists were well prepared and organized. Number 3, the panelists spoke clearly and audibly. Number 4, the panelists used appropriate language with technical medical jargons adequately explained. And finally, the panelists contributed to new perspectives and knowledge on managing various key health issues. We will not be closing this panel discussion poll until the end of our webinar. At this point po, we also would want to share that for next week, we have another exciting... wala po pala kami next week, because next week po pala is Good Friday. So that will be a holiday po, no? So we will be taking a break for next week. Okay? So ito po, thank you so much. We will not be seeing each other po next week, and we'll be back the week after, is the 2 Fridays from now on April 5th for our next episode. And I think we'll be discussing po what will be our episode for that one. We wish everyone prayerful and peaceful po na Holy Week break, and for everyone just to take the time to reflect po for this at this time of the year po. But for those who would still want to watch, you can still watch us sa TVUP na YouTube channel po, no? www.youtube.com/TVUPPH for all of our webinars po, no? 184 after today, it will be 185 webinars. We also understand po na everyone's very busy, so we also came up with what we call SCD shorts for us, and then we have renamed it to Health Updates Shorts. Ito po may matatagpuan po if you are able to navigate to the YouTube app. Meron po dun tab on Shorts. Doon nyo po makikita yung pong ating mga 1 to 2 minute videos po that we come up for, or we have come up with for this Health Updates webinar series po. For the 184 and after today 185 episodes, doon naman po sa live tab nung pong TVUP PH na YouTube channel po, doon nyo po siya makikita. So yes ma'am, go ahead.
I'd like to add also, no, kasi those who are requesting for certificates, kailangan 50% or more ang tagal nyo sa webinar. Hindi pwedeng, kaya yung iba siguro hindi nila nakukuha kasi baka walang 50% ang kanilang duration of stay in the webinar. And also for our speakers, we also give certificates of yung inyong contribution to TVUP, and this can be also for your department. I mean, for your promotion, nakakadagdag yan. So, basta mag-request lang kayo and we give you also certificate.
Okay, thank you so much, Ma'am Stella. So this formally closes po our webinar for the week. Magkita-kita po tayo again sa next Friday po, no? Our next Friday is April 5, which is 2 Fridays from now. So it will be from 12 noon to 1 p.m. And as you can see here on our evaluation poll, you'll be able to see that there are, well, at least 94% of our attendees or participants strongly agree with all of the statements. Just a testament po kung gaano po sila natuto sa ating mga speakers and also sa ating webinar topic at hand po. So magkita-kita po tayo again on April 5th. Not next week po kasi next week po we'll be taking a break. And we hope to be able to see you on April 5th. It's a date.
Together, we can stop preventable death.
So keep safe, keep healthy, and see you online.